I would like to now request our first speaker of the morning, Dr. Vijayabaskaran Sundararaju, Executive Director of Kauvery Hospital, to come and speak on the topic, Enabling Public Healthcare with Emerging Technologies. Over to you, sir.
Good morning, all. So, being the first speaker, I have to make an impressive presentation, so I'll do that. I'll try to do that. So, good morning, one and all. So, Kauvery is having a 25 years legacy. So, in the year 1999, the journey started with 30 beds. Now, we are having 12 hospitals in 6 locations with 2,500 beds. Just before COVID, so our tagline is affordable healthcare. So, in that sense, we want to do something different than the regular routine work. Every one of us in the hall knows that we are the capital for many of the lifestyle diseases, majorly diabetes and hypertension. So in that line, with or without cost, what can be done? So we started one startup company called Crudo Health, in which we deeply wanted to study in the dietary and lifestyle habits, how it can be monitored and modified to manage both diabetes and hypertension. In that sense, now almost in the hall, 100% of us are having smartwatches and smartphones. From there we started. Then we introduced what are all available in the market at low cost, like regular BP monitoring, BMI, ketometer, then CGM patches. Like that, we started using and evaluating all those wearables, how in day-to-day life effectively we can use for monitoring the various parameters that is happening in the body. That is one side. Second side, the changing lifestyle and dietary habit is a main culprit for these two diseases majorly I'm talking about. How the earlier traditional practice of, actually the forefathers, I think all of us will be aware, early to bed, early to rise, and intermittent fasting at weekly or fortnightly. Like that, there were so many good practices there. How those things are affecting our catabolic and metabolic activities, that one side. Other side, how our human body is responding to various food, take it idli or chapati or whatever it may be. It will be very interesting. Actually, we could be able to identify that when I'm taking 2 idli and you are taking 2 idli, what the calorie is producing completely different. And many times, chapati is the first dietary recommendation for diabetic patient. That also in a small portion of the population, it is working against. That also we could be able to scientifically prove. Then we started using the algorithms, and we are having a very, varied level of team. One is on tech side, who is very good in the wearables and all. Other one on the software side and dietary side, and social workers, then counselors, dietitian, and all are around surrounded by the clinicians. Like that we have done. And in our study, we had, chosen our friends, relatives, known population who are all having diabetes and prone to diabetes with obesity and all. Very interesting outcome, and we could able to come out with so many successful outcomes. And I want to recall only one, very fantastic outcome. One of my very close friend, who is my peer also, had a, abnormal BMI, and his HbA1c when we onboarded into this program was 13, and BP was very high, and he was taking 4-5 tablets to manage his diabetes, and he was about to onboard for insulin. Believe it or not, we have given first CGM patch, which is available right in the market. So 24/7 glucose monitoring can be possible. And interestingly, we could be able to correlate with the real-time blood sugar level and also CGM, and we are having a correction factor. With that correction factor, we could be able to fine-tune his regular diet. No major modification of his diet, only thing, the portions and mix and match of protein, carbohydrate, and fiber. So with that, believe it or not, within 6 months, his HbA1c, which was once 13, now it is 6.5. And from 5 tablet, he has been brought down to 1. And because of the absolute near normal sugar levels, all his other metabolic, catabolic activities are near normal. His hypertension has come down. His weight loss almost in 6 months 10 kg without any alteration in his daily routine and his energy level. Everything is normal because there is no reduction in the calorie uptake. So all those things are happening. In that we use CGM patch, smartwatches, regular monitoring of BMI, regular BP recording and ECG recording. All those are all not costly, which are all available just in a nearby nursing home, or if somebody is affordable, they can purchase. If somebody is purchasing all together, if it is Wi-Fi enabled, it will cost around 70,000-80,000. If they don't want, just CGM patch, it is 2,000 rupees or so. 2 cycle we have to use, 28 days, and absolutely. And when it is getting multiplied to a larger population without spending anything, just by changing dietary and lifestyle, amazing control, amazing management can happen in both the diseases. So this very simple device, and now with these results, Kauvery is going to launch in electronicity shortly, probably in a month or so, first time, a department called Preventive and Functional Medicine. The 4 years back, we started as a startup. Now, because of that, very cost effective and without any extra investment, 2 diseases are getting corrected. And in that course, very interesting things happened. Now we are working very seriously on the PCOD, and very seriously we are working on the cardiac diseases and also kidney diseases. When we could be able to attack diabetes, automatically all these things are, it is interrelated, correlated, because being a clinician and all, I think no need to elaborate and all. So like that, many of the things is possible when there is a way, there is a will. With smaller investment, larger impact can be, resulted is possible. With these few words, I'm open for discussion. If any questions, I'm willing to.